Welcome. It's really great that so many of you could join on with us today and join Dr. Clark and myself in the virtual world we're all living, in. You're joining her from her dining room and me from my also dining room. And just like all of your lives have been disrupted, ours have too. You may see a stray child of mine walking through the background or some kind of noise. And we're all doing the best we can. And that's what we want to convey to you, that what's most important is your health, both your physical health and your mental health, and in really taking care of yourself. And I'll talk more about some of the ways that the school and the university want to do that. For example, with our mindfulness center and the counseling and psychological services being available as telehealth and so many other ways. So we're glad that you're back with us. We're hoping the fact that we're back in classes is creating some normalcy, some schedule to the day. We recognize that, you're all in different places all over the world and adjusting to your lives. We hope that over the spring break and the moving time, you had some time to kind of recalibrate yourself a little, and that you are thinking about ways to take care of yourself. So the School of Public Health and Brown University are fully up and running and open. I think it's really important. I know some people say, on some of the media outlets, they talk about the universities closing, and we are not closed. We've just moved everything virtual, and we've really done our best to do everything we could to move things virtual. So thanks to Melissa Clark and her team, all the faculty and the TAs who've worked so closely and carefully to bring everything virtual for you for the classroom. We've heard from a lot of you that things are generally working pretty well, that the smaller seminar classes are working particularly well. Some of the larger classes, there's still a few bumps, and we want your feedback. We want this to be the best experience it can be for you, but also we want you to be patient with faculty and TAs as they're also adjusting to this new way to communicate. Again, extraordinary group of people coming together. I think you've all heard me use the phrase, it takes a village, and it really takes a village to make everything work. And we have a great village here in public health with you, our students, and our diligent staff and faculty working together for the best experience possible. We've talked about the move to virtual learning for you, and also many of you are involved in research. All of you are involved in research, and you've heard about the university regulations a few weeks ago that we shut down any face-to-face communication that's on campus. And so many of our studies have stopped or slowed. Others have been able to, with the help of a lot of our creative students, go into a virtual mode where data collection and intervention can continue. So thank you all for your participation there. Again, I want to underscore that, we understand the uncertainty. We feel it. And I've heard great stories about the innovation among our students, the number of you who are volunteering for COVID-related work in your communities, and just thoughtful feedback and comments. There couldn't be a more exciting time to be in public health. All of you, I'm preaching to the choir, right? You understand how important public health is, and that's why you've chosen to study it. It's really a moment where others around the world are understanding it. And hopefully it's a career path you were already proud about, and now you could even be more proud about the kind of impact we can have, whether it's with contact tracing, whether it's teaching people behavioral strategies, whatever piece of the work that you do, analyzing large data sets so that we can be modeling what happened in China, what happened in Washington State for predictions here. Really all of the aspects, and then thinking about policy, really. So all the aspects of public health, and our model of learn public health by doing public health couldn't be more important and more on display in a good way for the world. So thank you for that, and hopefully that's a proud experience for you as you persevere with a different way to learn public health right now. Again, we're coming to you, Melissa and I, live from our homes. And really what we want to encourage you to do is that while you are doing physical distancing, to still find ways to socially connect. So whether it's Zoom chats, at lunchtime with a fellow student who you would normally go get lunch with, reaching out to people, whether that's text or email or picking up the telephone or however it is. We're in this mode now for the rest of the semester, and it's really important to find alternative ways to connect, because I think we all have actually more of a need or a hunger for that social connection. We just need a different way to realize that. Also, I mentioned mental health. I think, want you to know our Mindfulness Center has daily free opportunities for mindfulness meditation. There's also yoga sessions free through the Mindfulness Center. And, today's a beautiful day where I am. I don't know what the weather is where you are, but I encourage people to get out and take a walk. You all know I study physical activity, so I particularly want to encourage that for the mental and the physical health benefits. Obviously, you all live in different places, and there are different regulations where you live. Some of you are in places where you're not supposed to leave your home. So of course, then finding some way to move in your home is what's most important for those who can get outside, even if it's just briefly. I encourage you to do that. And again, if you're in a place where the only ability to be outside is for a purposeful trip to the grocery store, again, try to get some outside time when it works for you. So following the CDC guidelines to take care of you is really important. Finding ways to rest and take breaks. Because our lives are altered, there's not necessarily the cue to start your day. Like some of you might have started the day going for a run, or started the day going and having coffee with a friend or something like that, and that's not necessarily the case right now. So finding ways to take breaks so that you're not sitting at your computer all day and all weekend is really important. And also encourage each other to do that. Again, even if it's a virtual break, to do an exercise class together remotely, or just to talk about your data from your research. So I'd like to do is give you a few updates about things happening at the school and the university. This is our first virtual town hall with our students. We had a virtual town hall like this with faculty and staff a couple of weeks ago. We'll just go for probably another 10 minutes. And we won't be taking live questions, although several of you have sent in questions, which we will try to answer today. So what I'd like to say is that, you've received many emails from the university, and many of them are chock full of information. So I really encourage you to read them. And I encourage you, if you haven't already, to bookmark the COVID website on our university's webpage. It's full of information, and it really answers most of the questions. If you're an undergraduate, if you're a grad student, if you're a research assistant, if you're a postdoc, if you're concerned about summer funding, many of the questions you have, most of them are there, or you would have received emails from the graduate school or the undergraduate campus, either from Andrew Campbell's office or Rashid Zia's office, which would give you FAQs and links to answer those questions. We are also, of course, here. All of us are still here and working in the leadership of the school, the department chairs, the department administrators, the heads of the undergraduate and graduate program, and all of the folks in the dean's office. So you can rely on us in the same way. You can't pop down the hall to see us, but you can send us an email or call, and we will try to be as responsive as possible. But I do think many of your questions will be answered on those communications. So please keep watching the emails, and please keep looking at that website. You won't get notifications when they update the website, but the website is updated often. For example, for those of you who came on at the very beginning, you may have heard Melissa and I talking about the date for when we're expecting the peak volume in the hospitals in Rhode Island has been pushed back from April 20th to April 27th based on new models. That may then have an update that relates to something else happening on the campus that would be updated on the website. So those are the kinds of things for you to watch for. So I also want to let you know that as well as everything in the school being open for business, everything in the university is. I attend all the meetings I usually attend, the president's cabinet, the president's executive committee, the senior dean's meeting, the APC, the TPAC, all of those meetings happen without, really missing a beat. And in fact, many of those meetings are happening much more frequently. Meetings that were monthly are weekly, meetings that were weekly or daily, so that we're all up on our communication. And hopefully you can rest assured that everything at Brown is operating as usual in this new reality. I don't really want to revisit all of the emails and changes that have happened because I know you're following along. I do want to say that I, like all of you, are really disappointed about commencement not being able to happen in the way we all had planned, and really for all of you that this academic year is just not going as any of us would have expected. So the good news is that students will graduate on time in a virtual way and be able to go on to their jobs and the next aspect of their lives. And I look forward to hearing the announcement from the university about a plan for a later date where we can all get together in person to celebrate. So I know that that's really disappointing. I also know that you all are really resilient, and many of you study resilience. And in fact, our next issue of our Continuum magazine at the school is about resilience, mindfulness, and mental health, one of the main themes of our strategic plan for the school. And so, so I know that you'll reinvent yourself, you'll reinvent ways to accomplish what you wanted to do, and we'll learn from this experience. Nonetheless, it's disappointing and not what we planned. I also want to say that, Melissa and I have been in touch with the Graduate Student Council and the Department Undergraduate Group. Thank you all for continuing your work and continuing to be a resource for our students. So if I turn to research, yesterday we had Virtual Public Health Research Day. We had 80 of you presenting your work. Hopefully many of you have gotten feedback on your abstracts. That portal is remaining open over this week. And so faculty, staff, and students can continue to go on and view each other's work and provide comments. I know how exciting it's been to see people's work, and we had an amazing team led by Ken Zirkle in the Dean's office put together the whole system, which is really quite magnificent. And I think that it allows you to get around to each of them and spend as much time as you want, which when we do our actual research day, others have said, it gets crowded in certain places or you don't get to spend enough time on each of them. So hopefully you can continue to go back, learn what each other's doing, and hopefully that'll bring new connections for you. And I mentioned that we've needed to go virtual for many of our research studies, and I think that's gone exceedingly well. If you have any questions about what's happening on the specific studies you're involved in, please reach out to the PIs that you work with. On the Brown COVID website, there is a specific section about research. And again, that can answer a lot of the questions about the research overall, also about stipends for students and other matters regarding summer, because summer is an important time for many of you to do research, and how it will happen this summer is unclear. But the details we do have available are on that website. And just, I should say that all of the things we do in the school need to follow the university's overall policies. And so we follow everything that's on that website. So again, last week's graduate and postdoctoral studies weekly update included a link with an FAQ that answers a lot of the questions about research. And I encourage you to go to that. As well as being in touch with your PIs and program directors. And again, for undergraduates, there was an email like that from Rashid Zia's office. So I want to also say that for those seeking clarity from your PIs and program directors, they may not be able to get back to you right away because they may have to reach out to, say, their project officer at the National Cancer Institute and find out if they can continue to fund a position. So people are working as hard as they can, our faculty and staff, to serve you. And I appreciate your having some patience if it takes a little bit longer for us to get some of these answers. A couple of points about diversity and inclusion. I want to welcome Dr. Caroline Kuo back from maternity leave to rejoin our efforts around diversity and inclusion in the school, and thank Ron Aubert, who stepped in very ably during Caroline's leave. I think in general, we continue to be in contact with OIED if we have any concerns or reports of discrimination or harassment or bias. And so also there was a recent publication that came out on Brown's statement on bias and hate that came out from OIED. I encourage you to read that if you have not. So we are very actively working in this area. We have heard some concerns from students, and we are addressing them as quickly as we can and bringing them centrally to the university. So that piece of that really foundational piece of our school around equity, around diversity and inclusion is all the more important while we're in this state of semi-disruption. So again, we're moving forward on everything. It's just a little bit different. I want to mention our community members, many of whom have really stepped up. So we have alumni and faculty on the front lines, like Dr. Nicole Alexander Scott, who has her MPH from the School of Public Health, who is directing our health department in Rhode Island. You're seeing her daily on press conferences, advising our governor, and really at the very forefront of the important work happening in our state. Another alum of our school, Dr. Megan Rainey at the emergency medicine program at Brown, is out there in the news, on the front lines, really representing healthcare at its very best. And of course, the continual message is to stay home. The social distancing does seem like it's working, and Governor Raimondo has been on the news repeatedly, really stressing how important that is. And she's a little distressed, actually, that Rhode Islanders aren't following the guidelines as closely as some of the other states are. So I'm sure you all are doing your part wherever you live to minimize contact. Other important areas, we've had faculty members like Mark Lurie, Angie Bankson, Phil Chan, Judd Brewer, and Jody Rich on the news, talking about policy, talking about education. And you know, really, we have a lot of gratitude for the many, many faculty who are stepping up in so many ways. And many of our students are included in those programs and projects and also playing prominent roles, which is really exciting. In the Department of Epidemiology, David Sabat, Steve Buca, and others and their students have been working together with the Rhode Island Department of Health and have led an effort which now has about 120 of us, faculty, staff, and students, who've listed the areas we feel comfortable volunteering in. If you have not filled out that volunteer sheet, please do. And then we are liaisoning with the health department so that when we're called upon, we can respond and know what the different strengths and interests of our students, faculty, and staff are. Some other things to note, Tonya Faye Sanchez, who's an SEM candidate at the school and a student ambassador, has been distributing information about how to help children through this stressful time and making a lot of connections that way and really supporting many people. And you know, certainly a very challenging area for how and what to talk about with the kids, especially as this goes on and has, you know, an undefined time frame. Also, though, for our students who are parents, understanding the challenges of having children at home, still trying to accomplish your work. You might not be living where you planned, and your child may not be able to be in childcare or school. And so we really recognize and celebrate and applaud the many roles that you're playing, and us also understand if some of your workday has to be a little more flexible. Other exciting pieces of ways our schools contributed, the Center for Alcohol and Addiction Studies put together 52 boxes of surgical gloves and protective gear and donated those to Rhode Island Hospital. The Center for Evidence Synthesis and Health is helping the Rhode Island Department of Health collect information about people who are quarantined. Abdullah Shihapar, who's getting his MPH this year, is managing Instagram campaign to keep people supported and connected, and you'll see a lot about it about people's pets. Which reminds me that this period of being physically disconnected has led to a lot of new opportunities to get to know each other. Like, I didn't know all the pets people had, and just fun ways to connect while we're socially distant. So I'm not mentioning everybody, but I really want you to know we're just delighted with all the ways people are stepping up in their local communities and in the Rhode Island community. And it's really appreciated, and it is what public health is all about. So thank you for your efforts. If you are doing something in your community and you haven't already shared that with the school, if you could please do that, because we're trying to keep a log of all of the great work everybody's doing in the community. So we have had to repackage some of our National Public Health Week events. And by the way, this we're in the middle here of National Public Health Week, which is an exciting time to be connecting with you. And so the next one that we will be having will be on April 14th, which is in conjunction with Biomed and the Watson Institute, where we'll be talking about the virus and the pandemic with a number of speakers from our school. And so this is a follow-up to the session we had in February about the virus. February seems like so long ago. The challenge is so different. At that point, really, we hadn't had cases in the US, and we're in a very different place now. So it will be great to hear from our wise faculty about the science. Also, the Hassenfeld Institute, which many of you are aware of, has a virtual question and answer for parents, for expecting parents. Expecting a child is always a stressful time, but even more so now. And so that website is updated with more information. So, just to recap before I get into the questions, the school is open for business. All of the functions are continuing. They're just continuing in a different way. We appreciate you and all you're doing to engage virtually in classes and in your research and in the community. And we look forward to staying connected even while we're distant. We did have a few questions that were sent in ahead of time, and I'm going to work on addressing those. The first is a question about undergraduate honors theses, following up on the email about prospectus deadlines being pushed back. So you will receive a follow-up email soon that will contain additional details and clarification, so please make sure to be on the lookout for that. In the meantime, feel free to be in touch with your professors and advisors via email. And you can also check with Elizabeth Mellon, who's our program coordinator for student engagement, and she'll be able to connect you to the right person. So there will be more information about that. We've also heard questions about ongoing work for student research assistants and future opportunities. So please know that we hear you, we hear your concerns, we hear that public health is more important than ever, and you want to get out there and get relevant experience. The school and the PIs are waiting information again from their funding agencies to be able to provide specific information. So please go to the school's website, the university's COVID-19 website about research opportunities, and feel free to be in touch again with the PIs that you work with. One additional question is whether the School of Public Health is considering any refunds for students because students pay into student activities fees. And we at the school follow the overall university guidelines. And so at this point, there were room and board refunds given, partial refunds given for the undergrads who are living on campus, but there are not any other planned refunds for students. So that may be disappointing to hear. And we're sorry about that. We know some of you might not have access to gyms and other things like that that were part of, perhaps part of your fees. But right now there are no plans for refunds in those areas. So thank you for those of you who reached out with questions. We will do future town halls like this. And if you have questions, we really want to answer them. And again, I just want to thank Dr. Clark, Melissa Clark, for her leadership, her connection with all of you to make sure classes are up and running. And again, thanks to the faculty and the TAs who are trying to serve you. Thank you for being patient with them, because you may know more about the technology than they do. And thank you to the students who've stepped up, who do know about the technology to help us. And I just, again, want to reiterate how important your health is, your physical health, your mental health. That is what's most important. And that we're here to serve you and to be connected to you. And you'll hear from us again, and you'll hear from us regularly. And we hope that you can engage in your virtual learning the best way possible and really find ways to connect with each other while you are in your distant locations. So thank you and have a nice day.